This is the 111 News from ICU Management and Practice. According to the Centers for Disease Control and Prevention, millions of people in the US have potentially missed the recommended window for their second shot. While 92% of people have received their second shot, around 5 million people may have missed their second dose. Dr. John Brownstein, an epidemiologist at Boston Children's Hospital, has highlighted the need to educate people on why the second shot is important to be fully protected against the virus, especially the new variants. Findings from a new study show that the health effects of COVID-19 not only stretch for months, but can also increase the risk of death and chronic medical conditions, even in people who are not sick enough to be hospitalized. Results show that between 1 and 6 months after becoming infected, patients had a 60% higher risk of death compared to people who had not been infected. Non-hospitalized COVID-19 survivors also had a 20% greater chance of needing outpatient medical care over those 6 months compared to those who had not been infected. France has reported an increase in the number of patients with COVID-19 hospital intensive care units. The total coronavirus death toll in France stands at 102,858. This is the 8th highest in the world. France is the second biggest economy within the Eurozone, and President Macron is hopeful that business and leisure activities could reopen in the country by May. The Oxford University team has created the first vaccine against malaria that has been reported to reach the World Health Organization's 75% efficacy threshold. The vaccine is 77% effective against malaria and has a significantly higher efficacy rate than existing shots. It is also the first vaccine to reach the WHO's goal of bringing an effective vaccine to the market by 2030. Researchers have now started recruiting for a Phase 3 clinical trial, which will include 5,000 children across 4 African countries.